It's worth recalling that some 30-odd years ago, Sir Roy Griffiths, in his seminal report on NHS management, observed that if Florence Nightingale had been carrying her lamp through the corridors of the NHS then, she would almost certainly have been searching for the people in charge. And it was the right diagnosis for the time. 30 years on, however, she'd be looking outwards, out into general practice, into social care, into the private and voluntary sectors, in order to find the people who would make her wards work better. In other words, she'd be looking for system leaders to work with her. For it is a truth now universally acknowledged that it is system leadership that the NHS and social care require, not just strong leaders of great but single organisations. But what does system leadership entail? Well, that was the question that we sought to at least partially answer by interviewing these system leaders on their views and experience. The interviewees range from the chief executive of a large county council to people who work with networks, clinical senates and academic health science networks. They included the head of a large voluntary organisation, chief executive of a large teaching hospital, a whistleblower, and individuals who have led or who still lead elements of the NHS at regional and national level. So what were their views? It was intriguing that all of them recognised the need for system leadership. A significant proportion had no wish to claim the title. To do so is to put yourself 40 love down before you start, as David Fish, the managing director of UCL Partners, put it. It can have really negative connotations. It sounds as though I'm telling you what to do, and we don't do that. We are instead a catalyst, an enabler. We're trying to help good things go faster. A second and related theme was that you can achieve almost anything if you don't wish to claim the credit for it. Or as one interviewee put it, you have to give away ownership. And you have to be able to walk in other people's shoes, understand the pressures they are under, the problems they face, and what's getting in the way of them doing what it is they actually want to do with you. What it essentially involved was an act of persuasion across the primary, hospital, social care, and other divides, persuading individuals and organisations to act in the best interests of the patients, even then that was not necessarily in the best interest of individual organisations, or indeed of the individuals involved. It thus required different skills to line management and additional skills to those needed only to lead a single organisation, and it is not a task that will suit every personality. As Thursday Tortel from North West London put it with deliberate humour, if you're someone who needs to take credit and needs recognition, you are probably not going to fulfil the role of working across systems and taking pride in other people's credit and achievements. I'm not making this sound very attractive, am I? No one notices what you do. It's hard work. It takes a long time. It's not much of a sell, is it, really, so far? It requires, perhaps obviously, but also ideally, a strong evidence base, not least to help convert the unwilling. And it starts with a coalition of the willing, from which one can build outwards. You need, said Ruth Carnell, Chief Executive of the former Strategic Health Authority in London, the best, most diverse group of clinical leaders you can possibly muster. One of the biggest sources of influence was your ability to get powerful clinical leaders on side and then take responsibility for leading it on your behalf. And time and again, these system leaders said it was crucial to involve patients, service users and carers in designing the new. They, after all, often have strong views on what is wrong with the present. And when they line up behind a system change, it is, as Jan Vaughan, the Director of Clinical Networks for Cheshire and Merseyside, put it, it's very hard to say to a patient, you're not going to do something because your trust is going to lose out. Plenty of paradox emerged. For example, system leadership requires both constancy of purpose but also a degree of flexibility in precisely how the goal is to be achieved. It takes time, but time is at a premium. And just because everything doesn't go perfectly at first, good ideas should not be dumped before they've actually been given the time to prove themselves. And it was out of those paradoxes that the slightly enigmatic subtitle of this piece emerged, about being comfortable with chaos. That's being comfortable with chaos on the way through, not comfortable with chaos as the final outcome. So what are the barriers? Well, unfortunately, they turn out to be legion. system leadership clearly worked best where there was stability of leadership, and everybody said that. And the current churn of chief executives, the lack of stability, is one of the many barriers. Then there was the sheer complexity of the current architecture, with NHS England, Monitor, the TDA, CQC, plus a host of other statutory and non-statutory bodies that can get involved. But all that led to difficulty over coordination of goals, targets and requirements. But it's clear that while nobody loved them much at the time, some people at least missed the former strategic health authorities. The complaints being that there is now no one place where people can be convened to resolve crucial issues. Furthermore, the consultation process for change and the myriad impact assessments and business cases involved was seen as a key obstacle. It came repeatedly under fire, just the sheer bureaucracy of it all. Well-intentioned, but it gets in the way. The London SHA once calculated that jumping through all the hoops for a major service reconfiguration, even if it was not judicially reviewed, took 2.5 years. And Ruth Carnell reckoned that's probably worse now than it was then. So a comprehensive review and slimming down of all that would be an entirely useful measure that the new government could take. For all that, the picture that emerged from these interviews was far from all gloomy. After all, those we interviewed had all achieved at least a degree of system change. And as I've already remarked, the collective interviews amount almost to a handbook on how to think about and go about the task. And this publication is a reflection of people's views and experience. It contains no formal recommendations. But the clear message from the interviewees is the job of system leadership would be a lot easier if it was made easier to do. So thank you.